The last three videos about an apple tree, a quill and a lamb have featured objects that were to do with very old kinds of transplants. Our next object is a coin, and this is more of a symbolic choice, symbolising the great changes that took place in the 18th century, of the Industrial Revolution and the Consumer Revolution that accompanied it. I could have chosen a tooth, I suppose, because this video is about transplanting teeth, a surprisingly popular kind of dental operation in the late 18th century. But it's really the economic dimension of transplants that I want to talk about, because a tooth transplant was the first time transplants came to be all about money. There's a famous cartoon from 1787 by Thomas Rowlandson, which depicts the tooth transplant as a financial transaction. To put it bluntly, thanks to the new science of dentistry, old people who needed their teeth extracting could now for the first time keep their smile by buying newly erupted teeth from poor children. In the picture, a filthy chimney sweep is in the dentist's chair having his tooth pulled. Sat beside him is a greedy-looking woman holding smelling salts to her nose. She's the recipient, and she expects to become one of the beauties that you can see on the right of the image. The sweep, on the other hand, he expects to leave a few teeth down, but also clutching a much-needed coin like the two poor children making their way out of the surgery, the ones cradling their jaws. This transaction of body parts and money was seen as so reprehensible that one 18th century story compared the dentist to a pawnbroker, and it says a lot about the reputation of dentists at the time when a pawnbroker, someone who makes their money from the misfortune of others, is depicted as taking the moral high ground. In the next video we'll look at the science behind this procedure, but here it's enough to point out that tooth transplants very rarely worked. From the start, social commentators were outraged on behalf of the penniless, desperate children, but nothing was really done about it until it became clear that wealthy recipients were getting ill and dying. That is when dentists and surgeons joined the social commentators and condemned tooth transplants, which were effectively a thing of the past by the early 19th century.